day, sir. I'm Shella Marie Burwell from BSN 1Y3T2B. So for today po, I will perform the demonstration or the return demonstration on bed making occupied. So ang objective po today is to safely change or do or perform bed making to promote personal or patient hygiene. So I will now begin with first checking the chart for limitation on patient's physical activity. So this promotes po patient safety. So since given naman po na occupied yung bed making po na gagawin natin, si patient po hindi niya po kayang tumayo or lumipat po ng or mag-transfer po sa isang bed para mapalitan po yung linens ng kanyang bed. So ang gagawin po ngayon is to change linen while nandyan po si client sa bed or the bed is occupied by the client.
Next is assemble the equipments and arrange on the bedside table to prevent disruption in the procedure.
Bedside table. So since ito po yung pillow mattress or yung pillow sheet, nasa baba po dapat siya since siya yung pinaka-last po na ilalagay po. Ang pinaka-taas po yung pinaka-nasa ilalim po or yung magko-cover po din sa bedsheet ni client po or sa bed ni client.
Next is perform hand hygiene to prevent the spread of the microorganisms.
Next naman po is I'm going to identify the client and explain the procedures of what we are going to do today. This validates po the correct client identification or correct patient procedure. Discussion reduces patient anxiety po. Good morning po ma'am, I'm Shalla Marie Pinarol, your student nurse for today. May I ask you po ma'am, what is your name po?
I'm Jason Agustin,
What is your birthday po?
May 4, 2007.
May I see your wristband po ma'am? Pwede po i-touch po. Thank you so much po. So ma'am, for today po, we will perform a bed making or occupied bed making. Change po natin yung linens nyo para ma-promote po yung patient's hygiene or yung hygiene po. Para ma-safely remove po natin yung mga linens, kailangan po natin siyang palitan para ensure po natin yung safety po niyo. Did that be okay with you ma'am? Yes.
Next is close curtains and door to provide privacy.
So, next naman po is I'm going to adjust the bed to the comfortable working height, usually elbow po height of the caregiver. But since hindi po siya namumove, naka-position na rin po si client, in-adjust ko na rin po yung bed niya. Hindi po kasi namumove yung pataas yung bed, so kailangan lang po yung gagawin po natin. Next po is lower side rail, nearest the caregiver, leaving the opposite side rail up. So yung i-place din po natin yung bed po in flat position unless po contraindicated or bawal po sa pasyente. Some patients po kasi hindi po sila pwede sa flat lying position. So yung flat bed po kasi it promotes or it prepare wrinkle-free bed po. So na-prepare ko na po yung bed po kanina, naka-flat lying naman po si client. So
Next is put on gloves, and I have already checked the bed linens for personal items, and I have already disconnected all the cobwebs or any tubes from bed linens to prevent discomfort. Have the patient hold onto the top sheet if a bed blanket is not used. I'm going to fold onto the linen that is to be reused over the back of the chair. I'm going to discard soiled linen in a laundry bag or a hamper. I'm going to use in this scenario a garbage bag in which I did not place the soiled linen on the floor and I did not hold soiled linens against my uniform to maintain hygiene. I have also assisted the patient to turn toward opposite side of the bed and reposition pillow under the patient's head. This allows the bed to be made on the vacant side. Loosen all bottom linens from head, foot, and side of the bed to facilitate removal of linens. Fan fold soiled linens as close to the patient as possible. This makes it easier to remove linens when the patient turns to the other side. Place the clean bottom sheet on the near side of the bed with the center fold aligned to the mattress. Fan fold it to the center under the old linens, then secure it over the head and foot corners. This reduces stain, ensures proper coverage, and makes linen removal easier. Next, place the draw sheet with its center fold aligned to the mattress and position under the patient's midsection. Fan fold it to the center and tuck it securely under the mattress. If used, place a protective pad over it. This allows easier linen changes and helps in moving the patient. I have already raised the side rail before moving to the other side of the bed and lowered the side rail. I will assist the patient to roll over the folded linen in the middle of the bed, reposition the pillow and back blanket or top sheet. This ensures patient safety and allows the bed to be made on the other side. Next is I'm going to loosen and remove all bottom linen. I'm going to discard soiled linen in laundry bag or hamper. I did not place it on the floor or furniture and I did not hold soiled linens against my uniform. This prevents the spread of organisms to another patient. Next procedure is I'm going to pull the clean bottom sheet taut, securing the corners. I'm going to smooth and tighten the draw sheet to remove wrinkles and to improve patient comfort. On this demonstration, I have removed pillow and changed the pillowcase on the latter part of the video. I'm going to apply a top linen, sheet, and blanket if desired so that it is centered. I'm going to fold the top linens over the patient's shoulder to make a cup. This allows bottom hands to be tucked securely under the mattress and provide privacy. I'm going to secure top linens under foot of mattress and meter corners. I'm going to loosen the top linens over the patient's feet by grasping them in the area of feet and pulling gently toward foot of bed. This provides for a neat appearance, and loosening linens over the patient's feet give more room for movement. I have also placed a blanket on the patient to provide comfort. Before turning to the other side of the bed, we're going to raise the side rail and we're going to lower the other side rail of the bed to prevent risk of injuries.
Fold po natin yung um, blanket po sa taas. Yung paganto po siya, then iyaan na po natin. Then ipapasok po natin yung pababa. Fold po natin ang paglayo ng pababa.
Next is I'm going to change the pillowcase, and I have grasped the pillow with the hand inside the pillowcase. I'm going to keep a firm hold on top of the pillow and pull the cover onto the pillow and place it under the patient's head. This will prevent the spread of the microorganism. Next is I'm going to return the patient to a position of comfort to promote patient comfort and safety. Along with that, I'm going to raise the side rail and lower the bed and reattach cowl bell to promote patient safety.
Now po, I'm going to dispose the solid linens according to agency policy po. That deters the spread of microorganisms. I'm also going to remove my PPE or my gloves po.
To maintain hygiene.
That will be all po for bed making occupied. Thank you po. Good day, sir. I am Shalimar Liberwell from BSN 1Y3T2B, and for today, I will perform a third demonstration on bed making unoccupied. So for today po, our objective is to effectively and safely perform bed making while maintaining patient's hygiene and patient's comfort. Now, I'm going to proceed with first assembling or gathering all the equipment needed so that during the demonstration, there will be, or the procedure, there will be no distractions. So I've already prepared all the equipment needed, which is the linens, the clean linens that will be used later on, and I've put it on the over the table. I've also prepared a clean pair of gloves and also an alcohol. So now I'm going to perform my hand hygiene and put on PPE as indicated to prevent the spread of microorganisms. Now I'm going to adjust the bed on a comfortable working height, usually above the or same level with the elbow of the caregiver. This will help us protect ourselves from injuries during the procedure. So I've also dropped the side rails for that, so that during the demonstration we can easily perform all the procedure needed. So I've already dropped the side rails and I've already raised the bed height. Now I'm going to disconnect all the connections connected on the bed, and also I'll also disconnect the call bell so that there will be no interruptions during the procedure. Now I'm going to put on gloves to prevent the spread of microorganisms, and I will loose all the linens or the soiled linens and perform the next procedure. So first, so after gloving, I will now loose all the linens, including din po yung sheet po ng pillow or yung pillow sheet. Then, after that po, I will now fold the linens, making sure na naka-fold po siya accordingly. Yung top po dapat nasa loob po siya, and yung nasa bottom po is parang pino-cover niyo po. This will help us avoid the spread of the microorganism and contamination. Make sure po na pag hinuhold po natin yung soiled linens, hindi po siya mag-touch sa uniform po natin, para na din po sa ating sariling protection. So if ang linens naman po natin is katulad ng mga blankets, if reusable po sila, we can hang them on over a clean table. But if not, gagawin po natin, isasama po natin sila loob nito, and ilalagay po natin sila sa disposable linen container.
If possible, shift mattress up to head of bed. If mattress is soiled, clean and dry according to facility policy before applying new sheets. Next is I'm going to remove my gloves. Gloves are not necessary to handle clean linen, but removing gloves properly reduces the risk for infection and transmission and contamination of other items. Place a bottom sheet with its center fold in the center of the bed. I'm going to open the sheet and fan fold to the center. Opening linens on the bed reduces strain on the nurse's arms and diminishes the spread of microorganisms. Centering the sheet ensures sufficient coverage for both sides of the mattress.
Nasa center fold po. Then, yung ating first, ito po yung magiging ni client. Then, maglalagay din po tayo ng underpad. If gagamit po siya ng underpad. Then, saka po natin iaayusin yun. Aayusin sa pagkaka-center fold.
Next is I'm going to pull the bottom sheet over the corners at the head and foot of the mattress. Having bottom linens free of wrinkles reduces patient discomfort. Next is I'm going to move to the other side of the bed and secure the bottom of the linens.
Blanket or the top linen. So, this one naman po. I-cover po sila natin. Ganito. So, para ma-cover up po yung dito. Ayan. Yung dito po, magagawa po tayo ng triangle method, which is i-hang natin siya dito, then ipapasok po natin yung dito para ganyan po siya. Malinis po siyang tignan. Same with the other side. Then lastly, since wala pa naman po yung patient, wala pa po tayong ilalagay na blanket, but now we will proceed with the pillowcase. So this is the pillowcase. Since malinis po yan, lalagay natin sa overbed, sa taas po niya. Then gagawin po natin dito para may technique po kasi dito. Po natin is ilalapasok natin siya sa ating boat na arms natin. Then kukunin natin yung pillow. Then saka natin siya hihilahin papasok. Then adjust na lang natin yun. See? Mas madali po siya. Ayan po. Then ilalagay po natin siya.
After that, I'm going to secure signal device on bed and raise side rail and lower the bed. This promotes safety and comfort to the client. I will also dispose soiled linen to prevent the spread of microorganisms.
And now, I'm going to remove my hand gloves. Yan. Then out. Then sa container. Then, going to use an alcohol. That will be all for my return demonstration on bed making unoccupied.